we'll go ahead and call the November 20th Hospital Authority Board meeting to order. I'd like to start out and offer an opportunity for anyone to disclose a conflict of interest. Do we have any conflict of interest to disclose? Seeing none, we'll move on to the mission statement. Dr. Martin, would you be kind enough to read our mission statement, please, sir?
The mission is to improve the health and wellness of Nashville by providing equitable access to coordinated, patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. And the vision is to be the leader in exceptional community health care, one neighbor at a time.
Thank you, sir. Now there is an opportunity for public comment.
There are none.
No public comment. Thank you. Next item on the agenda is the minutes. If our board members have had an opportunity to the review of the minutes from the October 30th meeting, do I hear a motion to approve?
Motion.
Is there a second?
Second.
Right. Any further discussion? All in favor? Aye. Any opposed? Motion passes. Since we have no old business, we'll move on to new business, starting with our department reports. So first on the department reports, we have our quality report, which will be led by Christy Lewis, our Chief Compliance Officer, and Felicia Denson, Director of Quality and Patient Safety.
Good evening, everyone. Tonight, we're going to do things a little bit different because we have our culture of safety survey results that came back, and I wanted to make sure that our board was aware of those. But also, too, I wanted to do a quick introduction because I have one of my quality team members here with me this evening. Dr. Ayuyinka Shilon joined us about 2 months ago, I think. Excited to have her on our team. She's helping support us with some peer review efforts, some quality and patient safety projects. So we're excited to have her here at our organization now. Moving forward, for our board report, tonight I'm going to cover the standard CMS metrics that we've covered in the past, but I'm going to continue to focus on our top 3 wins and our top 3 opportunities. So I'm happy to report that for the 3rd consecutive survey period, our first win is that we have earned the hospital grade of A. Yet again, this was a huge achievement. A round of applause. For our organization, a lot of work went into this to submit a lot of CMS data, but also, too, we're able to submit some of our process metrics and how we do business as an organization to reduce patient harm. So great job by us to earn this 3rd A in a row. And then our second win is around our barcode medication administration. For the 7th consecutive month, we have exceeded that goal. And this is around med safety and ensuring that we're barcoding meds to the correct patient, correct route, correct dose, and correct time. And then our 3rd win is around healthcare acquired infections and reducing those. We have gone well over a year now without a central line associated bloodstream infection, no catheter associated urinary tract infections, no MRSA bacteremia infections, and no surgical site infections related to hysterectomy or C-section cases. So great job by us there too as well. And now on to our top 3 opportunities. Our first opportunity is around hand hygiene adherence. We continue to do very well in doing hand hygiene audits as an organization, which helps support our A safety grade. But we are inching very closely to our 95% goal. The prior month, we were at 94%. We haven't been this high in a while, but we want to see ourselves as an organization to get to 95% and above, which studies indicate once you get to that threshold, you're more than likely to continue to sustain low healthcare-acquired infection rates. As an organization, we will continue to move forward with coaching in the moment, making sure we remind people to do hand hygiene when we don't see them doing it, and ensuring that we're including that in all of our quality-based meetings, department meetings, as well as our staff huddles. Second opportunity is around severe sepsis, bundle adherence. This rate, unfortunately, continues to decrease, and you can see in your packet on slides 4 and 5 where we certainly have opportunities to move the needle on this one. We had a meeting on last week as a work group to discuss some ways that we can implement deep dives to make sure that we're looking at individual cases as an organization, but also to engaging with our providers to ensure that they're aware of the fallouts that we're noticing, because a lot of this is around documentation, in particular in the medical record. And then our third opportunity is around improving our turnaround time for peer review cases. And with this one, we will be moving forward with implementing our multidisciplinary peer review committee structure, and we're working with Dr. Bullock and our chairs and chiefs to be able to do this as an organization to move the needle there. Are there any questions around our metrics before I go into the Joint Commission updates? Okay, hearing none. In your packets, if you look at starting at slide 7, the Joint Commission has come up with some updates that do impact our board, and that's the reason why I'm bringing them here tonight. They have modified what were formerly called the National Patient Safety Goals now into what is called National Performance Goals. With the National Performance Goals, what Joint Commission is asking is to empower our board, which is our governing body, to continue to be involved in quality and patient safety as an organization, but now they've added some particular metrics that they want to ensure that organizations are bringing forth to you all. So I'm bringing them to you guys to challenge us to make sure that we are bringing this information forward to you, but also to help support us in these initiatives in the organization. The key components that they're asking, well, not asking, requiring us to do is continue to report safety metrics and trends, which we already do those very well. Also bring forth our culture of safety survey results, which we started back in January of this year, and we will continue that. But one new item is they are requiring that we bring forth information around workplace violence and what we're doing as an organization. Dr. Elders and Dr. Brown and Jerry have all spoken about evolve and technologies and things of that nature we're doing to deter the likelihood of violence, but we want to take that a step further and continue to have routine report outs to you all about it as well. And then the last item, which is something that I think caught a lot of organizations off guard, is that they are requiring that we now bring forth information around staffing and how we're managing and evaluating staffing needs as an organization. And in particular, they mentioned in the standards nursing staffing. So going forward, you will notice that you'll have information coming forth to you around those items as well. We will be in our Joint Commission survey window towards the end of next year. More than likely, we won't get surveyed until the spring or summer of 2027, but I wanted to make sure we were well prepared for this going forward. Any questions about the Joint Commission updates? Okay, hearing none. On to slide 13 in your packets. We did get our cultural safety survey results, and the cultural safety survey is embedded in our employee engagement survey. And we had someone from Press Gang that came about 2 months ago to share those results. But today I'm going to focus on just those items that we're dealing with safety. As an organization, we received a score of 3.8 out of 5.0, which was not a major change from 2024 to current state. But what I wanted to share was some wins that we noted in our survey, but also a couple of opportunities that we have as an organization as well. Our biggest win on slide 15 is where we actually score 4.06 out of 5 in the area of prevention and reporting. And this shows we have had about a 31% increase in the number of safety incidences that our staff are voluntarily reporting in the organization. We use a program called RL6 where anyone in the organization can voluntarily submit any safety concerns, and we also get good catches and near misses in there as well. And when I went back to look at 2024, we had about a total of 481 incidents that were reported, And already in the first 3 quarters of this year, we had a total of 706 incidences. So we're happy that our staff feel empowered to be able to share what they're seeing, what they're experiencing. Then we as an organization can make sure that we're addressing safety concerns to reduce the likelihood of harm to our staff and to our patients too as well. Also, one of the highlights where we saw a significant increase was there's one question that the survey asked around just culture. And in this, it shows that our staff feel that we are improving as an organization, where they feel that we do not have a punitive culture, where they're able to report things and they feel that there's no fear that they're going to be disciplined in a negative manner, that we're truly practicing just culture principles and giving our staff the benefit of the doubt in being safe to report, and that we will do something about it as an organization. So that is certainly something to celebrate, that our staff are speaking to us and we're taking action. Our first opportunity, and I'm going to consider this a median opportunity because it came up in the median range on the survey result when we were compared to other national organizations. And this is on slide 17 with pride and reputation, where we scored 3.82 out of 5. With this, our biggest opportunity, and we are diligently working through this, is to make sure that we have an awareness with our staff and engaging with them in how we have process improvement. It's great that they're reporting things to us, but it's even more important that we engage with them to get them involved in the problem-solving process too, to make sure that they feel a part of making decisions and how they do their job and provide patient care too as well. And we have already incorporated this into how we do deep dives and follow-ups and things of that nature to make sure that we hear the voice of the customer from our staff. And then our biggest opportunity is around resources and teamwork. On slide 18, we scored 3.5 out of 5, and we did see this decrease slightly compared to 2024. And with this, it was very interesting that as an organization, we saw a significant increase in communication from senior leadership overall, but not between departments. This score, according to Press Gaining, shows that we have some opportunity to make sure that we're being good stewards of transferring and communicating information between care teams. And there's already things underway now where Sharon Pipes, I see she's in the room, as well as Bowman Dick, with our pharmacy team. They're circulating surveys now to try to get the opinions back from staff and how we can do a better job across departments in communicating and collaborating with each other. So last but certainly not least, in summary, just keep in mind that having that win around prevention and reporting, that's pretty huge. Most organizations can't tout the fact that their staff feel that they're safe to report things, and it's going to enable us to continue to be stronger and continue to maintain our safety grade of A, and then also continue to have lower safety incidences. And then also continue with the opportunities around collaboration to ensure that we're engaging with our care team members to get involved in process improvement work here at the organization. Any questions or comments? Yes, Mr. Lesser.
So, well, I've turned it on, but it doesn't seem to be lit up. Nonetheless, going back to slide 18, it just seems intuitively, anecdotally, that it's at odds with what we have been feeling about better communication during the course of this year versus last year. What kind of comment can you make about why you think it went down?
I think some of it went down keep in mind, the survey was done, I think it was around late July, if I remember correctly. And mid-year, we were certainly at an impasse. We were at an impasse with budgeting things. There was a lot of communication coming out around major changes that were going on in the organization. And I feel that we did a good job in communicating like those big things that came up that impacted the staff. But when it came down to things that were dealing with safety and how they do their work, that was certainly a missed opportunity. There are things certainly that we do as a leadership team amongst ourselves and collaborate, But with these results, it is majority staff that these results reflect and not the leadership team. So we took it as a call to action for us as leaders that we collaborate very well with one another and working through things, but we could do a better job in engaging with the staff to get their opinions and feedback and how to improve things as well.
Okay, thank you.
You're welcome.
The departmental communication, I mean, is that like between nursing and transport, nursing and pharmacy, nursing and dietary?
Yes, sir.
And so is there a particular single department that needs work? Is it more on the nursing part, on the dietary part, on the pharmacy part?
The results of the survey really does not drill down to department level unless a department themselves as a leader, like me, for instance, I get a survey from my department and their thoughts on communication and collaboration, and they might feel that is strong, but they necessarily won't mention or name a particular department. So for us, how we're going to address it as an organization, we know that we have a lot of projects that we do at the leadership level, and we do on a routine basis, but we don't always have a lot of staff involved in them. We have a lot of staff that are working on clinical ladder projects and things of that nature where we certainly have opportunity to involve them, but also, too, with those projects to make sure that we tie them back to things that they are actually reporting that we're doing things about where their voice is being heard and something is being done about it, but explain to them how it ties back into the work that they're actually doing so they're not looking at it as so high level.
I mean, it seems like if communication is an issue, it would be good to have that information up front.
Yes, sir.
Is that something we could do?
Yes, sir.
Okay.
Yes.
I just want to commend your quality team for the leapfrog Class A of all the hospitals in Nashville. I think there are only 4 that
Two.
are. 2, okay.
2 in Nashville proper, 6 in the metro area.
Yeah, so I think it's wonderful that you have achieved it and you have maintained it with all the challenges. So kudos to you and the team.
Well, thank you. It takes a team. Well, thank you.
Okay. Thank you very much for the report, Ms. Denson. There's no further questions. I will ask for a motion to approve the quality report.
So moved.
Okay. Is there a second?
Second.
Any further discussion? All in favor? Aye. Any opposed? Motion passes. Next up is the medical staff report. We will start out with Dr. Bullock and Dr. Enzare for the medical staff bylaws update.
Good afternoon. I am here to give the bylaws update, and I feel like Dr. Nezare needs to stand up with me here. This has been a labor of love for probably well over a year. We've had a lot of buy-in from our bylaws, our medical staff, our MEC. I think at the last meeting, we had actually sent these out for a vote, and we were awaiting the medical staff vote. We did have a quorum vote that was present on November 3rd, and subsequently, we are here for board ratification of our bylaws. I did send these out to all the board members, or had Janet send them out probably about 2 weeks ago for review, and had the opportunity to speak with a few of the board members on any questions they may have had. So at this time, we are here to ask for your ratification of our bylaws for the medical staff of Nashville General Hospital.
I just want to add that the whole process was very collaborative, and Teresa, the medical staff coordinator, worked great with us. There's so much team spirit. And the icing on the cake was when we sent it to the medical staff, there was no opposition. It was unanimously, I've never seen that. It was unanimously approved. And So that's just a testament to how much the medical staff bought into it.
Any questions?
Well, I'd like to make a motion that we, I guess, accept the bylaws or adopt.
So a motion's been made. Is there a second to approve the medical staff bylaws? Second. Any further discussion? All in favor?
Aye.
Any opposed? Yes, ma'am.
I'd like to make a comment. And so, Dr. Bullock joined us as our Chief Medical Officer in April of this year, and the amount of work that's been done to get the medical staff bylaws in the place to where you're actually ratifying them tonight was a big feat. So thank you, Dr. Enzare and Dr. Bullock. I believe for those members that have been here for a little while, we have been working on these medical staff bylaws for several years. And to get that done in such a short period of time is excellent work. And so I appreciate them and I appreciate their leadership team. Thank you.
I will also echo those comments, and we were, for those of you who have not followed this, this piece of work here that we were able to pass tonight, there were times where we weren't even meeting. So to get to this place where it was unanimously approved and supported is just, again, yet another tremendous milestone that this hospital, the partnership with Meharry and the physicians is just a tremendous, tremendous step. So for those of you who are newer, so I also applaud that. And since we didn't say any opposed, I will go ahead and ask if there's any opposed. I doubt it, but then motion passes. And again, thank you so much for this, and what a win for everybody. Thank you. So next up is our November credentials report. Dr. Miller.
So we have several providers that are up for either initial appointment or renewal. Initial appointments include Jennifer Owens, nurse practitioner in hematology oncology, Kevin Myers in rheumatology, Tracy Hicks, certified nurse midwife, Cindy Lee in anesthesia, Leslie Apia in gynecology, and then reappointment is Joanna Kaikai in internal medicine, Tyler Reese in rheumatology, Dontel Johnson in pediatrics, Rahaman Suara in pediatrics, Megan Bauer, physician's assistant in emergency room, Jamie Ware, emergency room, and Tokunbo Ogunlaya in internal medicine. We have temporary privileges in Cindy Lee, Christian Karamia, Philip Brooks, Leslie Apia, Jennifer Owens. Change in staff is Philip Bourne retired, Edward Hills retired, and then resignations, Anna Dewan, Osmadian Asa Edo in psychiatry, Dr. Chowdhury in OBGYN, Megan Adams in emergency room, and Daniel Schuster in otolaryngology.
Thank you for that report. Do I have a motion to approve the November credentials report? Is there a second? Any further discussion? All in favor? Any opposed? Motion passes. Next up is our committee's report. The first committee we'll hear a report on will be Mr. David Esquivel and the CEO Performance and Search Committee.
Thank you, Madam Chair. I'm very happy to report that the CEO Search Committee met last week, and on the topic and theme of long projects that have come to a successful conclusion, the committee received the news that the request for proposal process that we had been going through with the help of Metro Procurement to select a search firm to help with our search for a new CEO was finished. There was a lot of work that went into that. I'm very grateful to the members of the hospital leadership team who served on the evaluation committee. They met 3 times as part of this process, spent several hours talking about the proposals, in addition to an even greater number of hours reviewing the 10 different bids that we got for this. And so in our committee meeting, we went through that process and talked about how that evaluation process went, and looked at the winning bidder, which is AMN Leadership Solutions. And that is a national firm that specializes in healthcare executive searches. And so we talked about that. The committee reviewed the outline of their proposal and voted to recommend to this board approval of their contract. I'm now anticipating a later agenda item, but that was a big part of our meeting. And the other part of our meeting was the exciting news that if this board approves the contract and we move forward, then our next meeting is December 10. And I've confirmed with the team from AMN Leadership Solutions that that they will be present, and we will consider that to be our kickoff meeting for the CEO search process. And this board ultimately has a responsibility and will decide who the next CEO will be, and has deputized our committee to help lead that process. But I want to make sure to everyone on the board to know and encourage you, if you're interested, to attend that meeting on December 10th and any of the committee meetings after that, because now we're going to begin the work in conjunction with our partners at A&M to start this search process. Their anticipated timeline is 14 weeks. Which strikes me as, given how long it took to do the RFP, I'm going to think that that's probably going to be longer than 14 weeks. But that's the schedule that they have laid out, so that the board knows this is going to be a relatively fast-moving process, beginning in December and ending sometime in April, May next year.
Great, thank you. Mr. Esquivel, and the whole committee, you guys have put a lot of work into doing the due diligence, going through the process, and I know it has felt very laborious in time, but it is the process by which we are required to do at Nashville General Hospital, and I truly believe will create the very best outcome. And so, again, thank you for your leadership. Thank you for doing the work, and look forward to moving forward and finalizing our new CEO. So next up is our Finance Committee report. Dr. Enzare, Dr. Blackledge, and Ray Mercado.
Hello, everyone. So we'll talk a little bit about our financials. I'm going to start with the income statement summary, starting with revenues. Revenues were $2 million less than budget this month. Breaking that down into outpatient and inpatient, outpatient revenue exceeded budget by $2.5 million. And this is offset by $4.5 million decrement to the budget by inpatient revenue. And looking at the inpatient revenue a little bit closer, we had a $2.2 million reduction to inpatient revenue that was part of an adjustment related to accrued revenue in prior months. We also had a decrease in volume. Admissions, which averaged 225 in July through September, decreased to 188 in October for 16.4% decrease. Also, patient days averaged 906 July through September and decreased to 763 in October, or a 15.8% decrease. Expenses. Total expenses were $14.1 million, which are $979,000 over budget. Total expenses decreased from $14.4 million in September to $14.1 million in October. A couple of trends that have been recurring when we review these financials. Salaries, daily average expense of $175,000 stayed consistent from September. And pharmacy continued the trend of exceeding budget expenses by $265,000. And one quick item on the balance sheet. There were no material changes to the balance sheet except for cash, which is something we have experienced the last few months. Cash decreased from $13 million to $6.9 million, as expected, to fund operations and continuing to pay down from the backlog of accounts payable. And the next tab is the stats. Just want to call out one stat right in the just lower middle section, the clinic visits. For the current month, 5,136 on a budget of 4,656, or 10% over budget. And then if you slide over to the right side, looking at year-to-date, 19,486 on a budget of 18,473, or 5.5% over budget. Kind of highlights the increase of the actual revenue over budget, which has been consistent this year. Any questions on the financials, income statement, balance sheet?
It seems that, once again this month, that the observation days were higher than budgeted. Does that reimburse a lot less than admission days?
Observation days. That is a great question. I believe any tests that we do or perform will be billed, but if they're not, depends on how long they're there. But maybe Dr. Blockage, you could expand on that.
Correct. I want to make sure we cover the cath lab too, that one too. But yes, the observation, if we're paid or reimbursed for at an observation rate, it is going to be less than an inpatient rate. Right. At the same time, categorizing where the patient should reside is the most important and urgent, not whether or not we get reimbursed at which rate. But yes, that's correct. I want to make sure we address that.
You may bring it up.
Cath lab.
Yeah.
Yeah. That's the digital, whatever era.
Sure. Sorry. One other thing, there was a question about the cardiac cath lab a little bit further down towards the bottom there, a stat of 23 actual and 23 budget. There's what appears to be a formula error there. Basically, it's because there was 0 last year, and so that creates the error in the stat. Yeah. Any other questions? Thank you.
For the stats in regards to the cardiac cath lab, I do want to announce that Dr. Joseph Akama has joined our team. His start date was Monday. He is our interventional cardiologist, and we are planning to kick off. And so we should see some numbers there in the future for use of that cath lab. Oh, Dr. Akama. Yes, thank you, Dr. Akama.
So thank you. I appreciate you coming to the board meeting. We are really, and I mean really excited about you being here. So It's a great opportunity to have someone use this cath lab that we have built and start driving revenue and helping patients in this area. So thank you so much. We are going to ask for a motion to approve the Finance Committee report today. This is also a milestone for us. In the past, we had been approving this report, but we had paused due to just wanting to make sure that the numbers as presented were accurate and most importantly represented the full financial status of this hospital. And in the past that was questionable. So I am pleased to actually be able to call for this vote today because I have confidence in our finance department, obviously our leadership team under Dr. Elders, and the work that KPMG has done to help get our hospital in good stead. So would someone do me the honor of a motion to approve this finance report?
So moved.
Second.
Second. Any further discussion? All in favor? Aye. Any opposed? Motion passes. Thank you very much for all the work you've done. Next up is our contracts. Dr. Enzare.
You want to take the first one? I'm happy to. Okay.
I will speak to the first one. I alluded to it in the CEO Search Committee report. The first contract is with AMN Leadership Solutions. It was procured through a request for proposal process where there were 10 bidders coordinated by Metro government. The essential terms are that it is a 5-year agreement, and it is a 5-year agreement because it contemplates not just the CEO search, which will be the first search, but if the hospital needs further executive level searches, then AMN will be available to conduct those searches. The price term is that they have bid 29% of the first year's, 29% of the baseline of the first year executive salary. And so that is the exact cost will depend on negotiations with each executive, starting with the CEO, as to what the baseline salary is, but that will be the cost of the contract. We'd estimate that at, it would be $174,000 at an estimated $600,000 base salary. The agreement that is in the packet, I'll just tell the board, is because we went through the Metro procurement process, we are using a Metro template agreement. So that the agreement looks different than a lot of the agreements that this board sees. And because the award was only finalized on Monday, we met yesterday with AMN and have an agreement as to, well, the RFP process results in the terms of the agreement, but nailing down all of the particulars of insurance requirements and other things. I don't have a signature-ready version of this contract, but the template describes what will happen, which is the RFP materials themselves and the submission that AMN makes, which is what they propose to do for these services, and the price term will serve as exhibits to the Metro template agreement. So I wanted to highlight that for the board. Happy to take any questions.
Seeing no questions or further discussion, I will call for a motion to approve the AMN Leadership Solutions contract.
So moved.
Is there a second?
Second.
Any further discussion? All in favor?
Aye.
Aye. Any opposed? Motion passes. Thank you. Next up is the Advanced Sterilization Product Services Contract. Dr. Baxter.
Yes, so this is a new sterilizer to replace the current one, which is at the end of its life. It can't be fixed. It's a 3-year term. It will cost $133,000. Then if you include the service, then it's for $148,000. There was no RFP because the manufacturer is the only vendor for the equipment.
The equipment that we're replacing has been out of service for a while, and that we've basically been leasing a sterilizer, right?
This specific sterilizer, we have not, sir. It's end of life. The ones I've been here before, we have bought those. The new
But
present-
weren't we paying a company for each sterilization?
for the visits to come out to repair this, sir.
Okay.
Yes, sir.
Any further questions? If not, I'll entertain a motion to approve the Advanced Sterilization Product Services Agreement.
So moved.
Is there a second? Any further discussion? All in favor? Any opposed? Motion passes. Thank you, Dr. Baxter. Next up is Forvis Mazars. Oh, I'm sorry, that's skipped. Not bad. Next up is the Southwest Communications, Dr. Enzeri.
For new electronic cameras to replace our analog cameras. It's part of the larger capital plan. The lifespan is about 5 to 7 years, and there was some question as to whether if we move to another hospital, some of the cameras may be possible to move them. There's no formal RFP, and total cost is $181,479.58.
Where are these cameras used?
These are security cameras.
Dr. Martin, we discussed this as well, and the life of the camera we talked about with regard to the time frame of actually still being in this entity, and so there was a question raised, I think, that addressed that. But Jerry, is there anything else you would have to say about the security cameras and locations and needs?
I think you pretty much covered a lot of it. The security cameras, they're older, distorted. They're way past end of life, like a lot of equipment here. So this right here is a needed, and it was identified in a security vulnerability assessment that they be replaced.
And this falls in line with the quality report and those needs as well. Dr. Scott?
So moved.
Is there a second?
Second.
Any further discussion? All in favor? Aye. Any opposed? Motion passes. Thank you. Safid?
Yes. This is laboratory equipment for molecular infectious disease. This equipment will help us bring in some tests that are currently sent out, like TB samples. The term is 3 years, and the total cost is $185,238. Likely difference of $2,894 just by bringing it in-house. It would also help us discharge patients quicker, because when we send those out, sometimes it can go for 7 days waiting for the results. Now you can get some of them same day or the next day. So there is some savings, and as well as better patient care, because you can make decisions quicker. No formal RFP was done due to the advanced technology with this.
One of the things that I talked to Dr. Elders about is that if we have this equipment, we could become a resource for other Metro employees, especially when it comes to screening for TB, and it might even be a source of income for the hospital. So they're going to look into that, because currently, I think the health department, this department, and probably even the police department refer to the state, which is a 2.5-day turnaround. So.
I'd like to make a motion that we accept.
Second.
Motion been made and seconded to approve the Cepheid
Cepheid?
contract. Is there any further discussion? All in favor?
Aye.
Aye. Any opposed? Motion passes. Next up is Beckman Coulter.
Thank you. Replacement for the chemistry lab system, so tests like kidney function tests, liver function tests. It's gonna replace the old system, which is 10 years old, past its lifespan. So this is also going to lead to rapid results. Chemistries can be returned to the providers within an hour or less compared to the current old machine. It's a 5-year term, starts on the day of signing. There's a 30-day out clause. No formal RSP was done. Beckman Coulter makes this, it's cost neutral at the current operating costs.
Any further questions for Mr. Pence? Not, I'll entertain a motion to approve the Beckman Coulter contract.
So moved.
Motion's been made and properly seconded. Is there any further discussion? If not, all in favor? Aye. Any opposed? Motion passes. Thank you. Appreciate you going through those contracts, Dr. Inzare. Next up is the interim CEO's reports. Dr. Elders.
Good afternoon, everyone. So I only have a couple of updates that I'd like to share. I don't have a written report in your packet, but one, Dr. Blackledge did speak about the audit and provided an update there, so we are timely with getting that in this year, which we haven't been or weren't last year. I do want to just echo, we were one of 2 hospitals that received the Leapfrog A, and we're so very excited about that for our hospital and our staff, and further just our patients and their overall patient care. An update on our comp study, we did complete a new RFP process for that. It ended on yesterday. There are a number of companies that submitted proposals. A committee will be evaluating those proposals moving forward, and we are looking at a deadline for the January board meeting. We're going to really push and press for that. Our Deloitte HR transformation project will conclude after the Thanksgiving holiday, and they have alerted us that they will have their report to us on Monday, and then we'll have some follow-up discussions that will include our board chair in regards to that report out. We have some Cerner. 11 months ago, we implemented Cerner, so I'm going to relinquish the rest of my time after a brief comment to our Cerner executives that are here as our guests to talk to us about that. But as we go into the holiday season, Thanksgiving, I just want to say thank you to all of you for your service to the Hospital Authority Board, the transformation that we have witnessed firsthand ourselves as staff, being interim, still staff member of this hospital. And so just the transformation for us and the work and dedication that you all have put in to help us achieve that has just been phenomenal. For our capital improvements, if you look out, just outstanding items in regards to security, safety, our HVAC system, just very minimal things that you would anticipate a hospital to have. We've also been able to achieve this year. We replaced every mattress. That was the last week. All of those came in, and so just those TV distribution is happening right now in our patient-facing areas, and so these sound like small things to other places, but these were very, very big things for us this year, and so we just thank you for your dedication and your service. And then I'll introduce our Cerner executives. Melanie, if you wouldn't mind coming up, and thank you.
On December 16th of 2024, Nashville General went live with Oracle Health CommunityWorks. we chose Oracle Health not only because it was the clinician's choice, but also because it offered a more complete and integrated solution than any of the other vendors that we partner with. We are at the 1-year mark, and while we consider this to be a successful partnership, we do have some opportunities for improvement that we are addressing with our Oracle Health team. Reporting continues to be a challenge for us. We were very robust with how we utilized our Power BI, and the solution that we have now has provided us with some challenges. Additionally, we have continued our partnership with a third party for our patient accounting, and that has also provided some challenges for us from how we integrated with Oracle. One of the biggest things that we chose Oracle was the one patient, one record concept, and the streamlined methodologies and the streamlined workflows that we would have with the vendor. Here on site, I have Brian Young, and I'm going to ask you guys to stand. Brian Young, our client account executive. Brian is here with us almost on a weekly basis, and he helps us work through many of the challenges that we are facing and have come to some great solutions with. Matt Laurie is our customer success manager. Again, as we have challenges, he is the person that we escalate up to. Megan Cassidy has been around since our sales. So she is the Senior Director of all of Community Works, and Eric Geis is the Vice President of Community Works. They are definitely in lockstep with us, and I'm going to let Eric come up and share some insight, and then maybe Matt will have some insight.
All right, thank you, Melanie. First, I just want to say thank you all for the opportunity. It's really good to engage with client leadership teams and board, and we know you do very good work for the Nashville community. So we're definitely your partner. We're 1 year in, as Melanie said, and there's still a lot of work to do together. So I'll give you an update on overall Oracle, as well as talk about the project and what we see. I cover around 300 clients across the United States, so I get to see a lot of things. And have been in this industry for over 20 years doing hundreds of implementations, so lots of experience, as well as Oracle acquired Cerner about 3 years ago. So we have been going through a lot of integration, product modernization, improving our overall products and services. So Oracle is making significant investments in healthcare. We're a leader around the world in cloud and AI and application development. Healthcare was the last major industry that Oracle was not in, so that was the reason why it acquired Cerner 3 years ago. Very, very significant investment, lots of opportunity in healthcare that we continue to see with data and analytics and population health. It was very nice to hear the quality survey results at the start of this meeting. That was a lot of the use of the products to do the medications and the infections and some of the safety work that she spoke to, so that was really nice to hear some of the positive results. We do continue to add new clients on a regular basis, so that's been very positive for us. You're on a good system. You have a really good foundation in place, but as Melanie said, there's always room to improve. Go Live is really the beginning of a journey, so there's a lot of work around continuous optimization, training, change management, cross-departmental communication and processes like we talked about earlier in the survey. You're on an integrated system, so certain changes in certain departments impact other departments, so there's got to be good change control and governance. From a reporting standpoint, we do continue to improve the reporting that we have. We think there's some near-term things that we can do with the departments, holding some more listening sessions and make sure we understand what the needs are, and guiding on the best practices that are available today. And then we are in the process of moving our reporting that Cerner developed in the past over to Oracle Analytics, which is more of an industry standard tool used in many industries around the country. There's also a project that we have getting kicked off really soon together between Nashville General and Oracle for an enterprise data warehouse. So that will allow you to bring in multiple data sources from different systems that you have, build more robust executive dashboards, and really just have some more state-of-the-art reporting available to you. Melanie talked about the need for an integrated patient accounting. The configuration that you're in today is very unique. It's very custom. We're all doing our best to make it work. The clinicians are using the system well. You're getting good charge capture and revenue coming in the door, but going through the complicated integration that we have in place with patient accounting, there are some challenges and opportunities there. So we do recommend that you move towards an integrated patient accounting solution. That is a big change and a big project, so something that you will have to plan for. We'll definitely consult with you around that. We've got a lot of clients that have gone down that path before. I think those are... Yeah, I think those are all my comments for now. Happy to take questions or answer anything from the group.
So the integrating accounting system you're talking about, we're using a third party now that's tied into Cerner. You're thinking that we would get a Cerner product, or how would we make that work better?
Correct. Yeah, you actually own the Cerner product. It would more just be implementing the Cerner product. You guys have outsourced billing. So at the time, it was really hard to, it wasn't possible to implement our patient accounting product with your third-party outsourced billing department. So both those decisions are connected together.
What's the fix?
You want to take it?
Yeah, sure.
Okay.
I think it's going to take a lot of consideration. It's not a quick fix today. We are working through our processes now to make sure that what we have in place now continues to work and get better. Long term, we will look at the patient accounting solution to see if that is ultimately the best choice for the organization.
So you're saying that right now the outsourcing is the practical way to go?
Yeah, given that same choice today, we would make that same choice again, for sure.
I just wanted to comment on the beautiful parts of the Cerner for the physician. So before Cerner, if I order labs on patients, I have to go myself and find the labs and check to see if it's normal. Now, when I turn Cerner, I see abnormal labs, I see critical labs, I get message from patients. It's beautiful. It's like night and day, so it's really a nice system. But is there a possibility of a health information exchange so that when my patient goes to Centennial, when they come back to me, I can access the CAT scans that were done there? Because some systems have that.
Yeah, so thank you for the feedback. I'm glad that the system's working well for you. From an interoperability standpoint, yes, we have a lot of capabilities to interoperate data across different EMRs. So you have some of that live and in place today. Melanie and I can look at this specific scenario and see what's needed to improve the interoperability. But yes, we can do that.
Thank you.
Yeah. The other thing I would say from a physician standpoint is we're doing a lot of work around artificial intelligence. So there's some new products around AI that I think will be very beneficial for the physicians and nurses that we're also having some good discussion around right now.
I had a question about, when you talk about some of the changes, the challenges and things, all the different pieces that are way above my pay grade, how are they negatively affecting how we're operating now? Is it these inefficiencies causing errors? Are they costing us money? Is it costing us more people to figure this out? That's the first question. And then the second question would be higher level and maybe forward thinking about if you, Eric, were to, now that you and your team, and maybe it's for some of you here on the ground, were to think about where we are now and build out in an optimal place, what does that look like? I would love to have you guys come back and give us a layout and a plan and a process by which we would get there to be at optimal efficiency. What does that look like? What are the timeframes and pivotal points by which we would need to reach those? Who would need to be in place to help us get there, and what does it cost? Because I think, what we spent a lot of time and a lot of money with this hospital to try to get to the place where I feel like, again, as a very novice-minded individual with technology, where we should be. And it's great to hear Dr. Enzere say that all these things are a leap from where we have been. But I think a lot of us sitting at this table are looking at where we want to be and where we want this hospital to be. And obviously a lot of that is technology, and most importantly with a partnership that is building a massive complex right down the river, and one that's going to have extreme visibility in our city. So it makes sense to have you guys intricately involved and for us to be really in lockstep here. So I think we look forward to the partnership. I feel like we all see the opportunity. We look forward to leaning in and love to see some of these things take off.
Okay. Yeah. No, we appreciate the partnership, absolutely. I'd say with your first question, the thing that I see, and Melanie, you can on Audit, it's more just efficiencies with the system. I mean, the system is working in a lot of ways, and there's a lot of value and use of the system on a daily basis. But we do see opportunity for people to, get reports more efficiently, adjust some of their processes around the system. Change is hard. You go from one system that was more decentralized to now an integrated system. There's change and communication and processes and data across departments there's opportunity there. So that's really the work that Matt and team are starting to do with the customer success organization in partnership with Melanie and team. So it is a department by department thing. So that's the first piece. And then I'd say secondly, absolutely Brian and Megan are road mapping with your team to really build out more of a strategic plan and roadmap based on the vision and strategy of the organization. So we did a lot of that work during the sales process. We've implemented, 90% of what was originally purchased. We're going to go implement the reporting and analytics for the enterprise data warehouse, and then we're going to continue to roadmap and plan patient accounting, AI, and some of those components. And then lastly, Oracle's very excited about what we're doing in Nashville. I was with one of our leaders last night that relocated here, to Nashville. We continue to relocate some people here. We continue to add jobs to the community, and our campus plan is continuing to progress.
Madam Chair, and that's a great segue to the comment I want to make. Many of us do not see Oracle as a California company. We see Oracle as a Nashville company. And in that regard, you say you're working with 300 different entities across the country. We hope as we go through this process that we can both stand together and say this is the very best cooperation, the very best effort that Oracle is putting forward, particularly for a hospital serving the kinds of folks we serve, so that we can stand up one day as partners publicly and say two great entities are working together on behalf of the people of Nashville. So I would just challenge you to make sure you keep that in your mind as we move forward.
Okay. Yep, will do. We want the same, and we welcome the opportunity.
Thank you very much for your presentation and the comments. Look forward to hearing back from you. Anything else, Dr. Elders? Okay.
Madam Chair.
Yes, sir.
On Tuesday evening, the former Vice President was here in Nashville. While standing in the meet and greet line, a lady from Columbia, South Carolina, blacked out 3 times. The medical staff came to tend to her. She refused medical care in that she did not want to go by ambulance to Vanderbilt. The driver of Dr. Michael Eric Dyson offered to bring her to Vandy, I redirected her here. She showed up to dinner feeling better and talked about the excellent care that she received. On the phone with her daughter, who's a medical doctor, her daughter kept asking for discharge papers, and this lady continued to say to her daughter, the doctor has already sent the documents. And she continued to stress that. I just want to say that the system that I just heard this discussion about seems to be working. Got an email yesterday from Dr. Dyson thanking me for redirecting her to Nashville General. Kudos, Dr. Elders, for the work that you all are doing. Thank you, Janet, for helping to facilitate her care.
Thank you. Thank you. Thank you for sharing that that story and message, and obviously it's great to hear these stories. We know they exist. Sometimes in the media you only hear bad things because that's what, people like the fervor. But it's really nice to hear these things, especially when it has to do with our hospital and people who are giving that care. My comments are basically, I wrote them all out and then realized that Dr. Elders has mentioned the majority of them, and then I've already talked about most of them. But when I count them all up, there are 6 major things that we've been able to do in basically an hour. And, being on top of an audit, getting our final approval for the RFP, the cath lab, the leapfrog, the bylaws pass, it's just, it's amazing to see what an engaged community, an engaged board, and where we've really come from, and the staff that's really leaned in. And I look around, I see happy faces from the staff, where it's just so encouraging. I guess I want to end my part of the meeting by saying just thank you. It's a pleasure, I know, from all of us to be able to work and come in and really just be proud of Nashville General Hospital and what all has been accomplished. So in the time of gratitude, I was always told that we can't have Christmas before we have Thanksgiving. So we still have turkeys up at my house and pumpkins. But I just think it's so important to be thankful. And it keeps you grounded, and it keeps us empathetic. So on that note, I appreciate everyone here in the room, all the people who have hung in here and weathered the last bit to get to where we are. So thank you for our new friends here at Oracle. I appreciate that, and everybody have a wonderful Thanksgiving. We will not be here in December, in case anybody has forgotten that, but we will be back here in January. We will be kicking off and ready to go. So thank you for your time, and on that note, I'll accept a motion to adjourn. Thank you.
Second. All right.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.